As we move on to the large bone that makes up the upper leg, the thigh area or femoral area, is the femur. And so the femur has an enormous head on it, one of the largest heads on any bones in our body, and then a most obvious neck. So the head of the femur is what fits into the acetabulum of the os cox. And then to support muscles, we have two very large projections that we see on the femur. So the one that would be lateral in anatomical position would be the greater trochanter. And then the one that would be medial and slightly posterior in anatomical position would be the lesser trochanter. So the thing to remember is that on the femur is the only bone with trochanters. And women's trochanters are slightly lateral, men's trochanters are slightly anterior, which is why women have a secondary bump in their hip because of the trochanter. Now what you'll notice is that as you look at a femur, there's a gradual and posterior curve to the femur. And if you look at the posterior surface of the femur, there's actually a ridge on the shaft. So this ridge is for connections of muscles, so it's called the linea aspera. Now as we're looking at the linea aspera, we'll see that it Y's right here. And as it Y's, then we have a ridge that goes down toward this smooth surface and a ridge that goes down toward this smooth surface. These surfaces are called condyles, and so these ridges are called supracondylar ridges. And so we'd have a medial and lateral supracondylar ridge. So this incredibly smooth surface is a condyle. And then we have a deep depression between these condyles, which is a notch. So this is the intercondylar notch. And then what you'll notice is we look at it from the side is above the condyle, we actually have this elevation on both sides. And this is again for muscle and ligament attachment. So since these are condyles and these sit above the condyles, then we share a characteristic similar to what we saw in the elbow, where these are epicondyles. And so in anatomical position, this would be the medial condyle, and this would be the lateral condyle. Now, as we move from the femur, the bone that directly articulates with the femur is the tibia. And what we'll notice at the proximal end of the tibia is we have two very flat surfaces on which the condyles of the femur sit. So the two bones would fit together like this. And then what you'll notice as you look at it is there's an elevation between these two condyles. And so this is the intercondylar eminence, which is going to be important to the attachment of a couple of ligaments, the cruciate ligaments that keep the knee together. So as we look at the proximal end of our tibia again, the one thing we'll notice is there's a promenade elevation right here, which is called the which is called the tibial tuberosity. And the tibial tuberosity is what the quadriceps muscles attach to. And so if we find the tibial tuberosity and move down, we'll notice that the anterior aspect of the tibia has got a real sharp ridge on it. So this is the tibial crest, which is what you hit when you hit your shin that hurts because there's nothing but skin above this. As we move downward, what we'll notice is that on one side we have a prominent projection. On the other side we have a depressed smooth area. So on the medial aspect we have this projection, which is the medial malleolus, which actually is the inside bump in your ankle. And as we rotate it, look at this, this is the fibular notch. And so if we put the fibula in place with the tibia, then it would sit like this. It would sit like this. And so what we see is that the fibula fits in the fibular notch. And then what happens is we have another projection on the bottom of the fibula, which creates a kind of depressed area where the ankle is going to fit. And so this enlargement of the distal end of the fibula is called the lateral malleolus. So the two bumps in your ankle are the medial malleolus and the lateral malleolus. Now if we look at a foot, then what we'll see is that those two malleoli create a socket in which the foot can set. So as we look at a foot, the tarsal that actually articulates in that socket is called the talus. And the talus has this really nice rounded surface on it. And then the talus sits on a fairly large bone that forms the heel of your foot, which is called the calcaneus. Now the calcaneus is large because on the posterior aspect of the calcaneus is where the Achilles tendon sits. So when you plantar flex your foot or stand on your tiptoes, the force of that tendon is all put on this bone to lift your weight off the ground. So the calcaneus is a very large bone. As we look at the organization of the rest of the tarsals, then what articulates directly with the talus anterior is a bone that we see sitting here, which is the navicular. And so it's kind of moon-shaped. And then as we continue distally toward the toes, we have three bones that articulate with the navicular bone, which are all three called cuneiforms. So we can number them, first, second, and third cuneiform. Or some people use medial, intermediate, and lateral for the same bones. Numbering is nice because the numbering is going to follow the metatarsals that we're going to do. Then if we go forward from the calcaneus, we're actually going to have a bone that's kind of cube-shaped that interacts with the fourth and fifth metatarsal, and so it's called the cuboid. So we get to the long part of our foot. These are metatarsals. We start with the great toe, which is the first metatarsal, second metatarsal, third metatarsal, fourth metatarsal, and fifth metatarsal. Now what's interesting is the fifth metatarsal has this real large projection on it. So it's kind of an interesting bone to look at. But we're not going to get into the detail of that name. Now, as we look at the phalanges, then the foot follows the hand in that the great toe, the hallux, only has a proximal and distal phalanx. All other toes, which is kind of funny, even that dinky little toe, your little pinky, have three bones. So again, we would use proximal, intermediate, and distal to describe the three bones, and then we would number them. First, second, third, fourth, and fifth. So this bone right here, then if we wanted to correctly describe that to someone, would be the fourth distal phalanx. So our last bone, which would fit in the joint space between the femur and the tibia, is our little bone that we commonly call a kneecap, which is the patella. When you look at the patella, you'll notice that the posterior surface has got real smooth surfaces which fit into this little notch right here, and then the more rough surface of the patella is the anterior surface of the patella.